Are you avoiding dentists because you're scared of dental cleaning? In today's video, I'm gonna show you step by step so you can be confident and prepared. Hi, I'm Mila, and on this channel, I wanna explain your dental care in simple terms, no pressure. Let me walk you through what typical dental cleaning look like. Health history check, dental exam by dentist, scaling, removing hard buildup or tartar, polishing with gritty paste, flossing, fluoride, optional, especially for high-risk patients. Let me walk you through what does typical dental cleaning look like. You're going to see hygienist. They will go over health history with you to see if any changes. Next, you're going to see dentist. Dentist will go through x-rays to see if any changes with your teeth. Then hygienist will scale your teeth using different instruments, depends on your preference. It can be hand scaling or can be like little machine. Then they will polish your teeth with some paste. They will ask you what flavor you like. It's always many choices like mint, strawberry, melon, any choices you like. Then they will floss your teeth, and at the end they will ask you if you like a fluoride to be applied on your teeth. It depends if your health is okay to do that. Many people feel anxious about scaler and worry about pain, but those tools meant to be gentle, and you can always speak up and tell your hygienist if anything uncomfortable. After age of 40, your gums start to change. Skipping cleaning can lead to bone loss, gum disease, even tooth loss. You can make your appointment easier by brushing and flossing regularly. Letting your provider know about any sensitivities. You can bring list of questions, asking about numbing gel or sedation if you feel anxious. Now you know what's really happened when you go to see hygienist. I hope you feel more in control of your dental health. If it's helped, give me a like, subscribe and comment below. Have you been putting off your dental cleaning?